Scoliosis is the sideways curvature of the spine, and in 80% of cases, the best medical evidence currently states that we have no idea why it occurs. Intervention for scoliosis can range from a simple monitoring approach to extensive surgical rods that last a lifetime. So when is it appropriate to intervene versus simply monitor the progression? We'll discuss scoliosis in just a moment.
Welcome to this episode of Hometown Health, hosted by Dr. Dan of Turo Family Chiropractic.
When you look at your spine from the front, the optimal alignment should be a straight vertical line from your skull to your tailbone. When a scoliosis occurs, even a mild one, the spine is no longer in proper alignment. How does that happen? As I stated before, medically, we have no idea why in 80% of cases. However, chiropractically, there is an explanation. You see, a scoliosis does not just appear overnight. It takes time to develop. If there is a misalignment or motion restriction in the spine, also known as a vertebral subluxation, there will be forces known as the piezoelectric effect that can cause asymmetrical bone growth. In a developing spine, if one side grows at a more rapid rate compared to the opposing side, then you can develop a sideways curvature or scoliosis. The approach to your scoliosis will vary greatly depending on the severity, the location, the timeline, and age of detection. The good news is that in cases of mild scoliosis that are detected well before spinal maturity, around age 20 to 24 years, spinal correction is possible with specific chiropractic care. When we focus on restoring proper alignment and motion to the vertebral subluxation, piezoelectric forces are normalized and the scoliosis may be reduced or corrected entirely. Children respond extremely well to gentle, specific chiropractic adjustments. Quite often, just a handful of adjustments can make a huge difference to a growing spine. That was the case for Liam. In just 8 weeks, his previously undetected scoliosis was now corrected. He now comes in periodically with his family for spinal checkups to make sure that he continues on the healthiest path that he can. For curvatures detected later in life, the goal is much different. In several cases, I have adults in their 60s that presented with severe scoliosis, measuring over 60 degrees. Imagine trying to take a 100-year-old tree with a bent trunk and trying to forcefully straighten it. The result cannot be good. But that does not mean the tree cannot continue to grow healthy and strong for another 100 years if the conditions are right. In the same respect, an adult with a severe scoliosis has adapted to that curvature for decades. That is their normal. It may not be the ideal normal, but it is theirs. And our goal is to cultivate, stabilize, and strengthen the spine and allow for optimal daily function for decades more to come. The best way to find out if you or your family member has a scoliosis is to have a spinal checkup with a chiropractor who takes x-rays. Other signs that scoliosis may be present include visibly uneven shoulders, having one shoulder blade that appears more prominent than the other, an uneven waistline, or one hip that is higher than the other. I encourage everyone who has a spine to schedule your spinal checkup today. That way, you are sure you're growing in the right direction. If you think that you or your child may be showing signs of scoliosis and are looking for the correct solution, I'm happy to help you find the root of the problem and work with you to correct it for lasting results. If you would like to find out more about this and other health topics, please join us for one of our upcoming community events or connect with me directly about your specific health questions. And remember, I'm here to help you get healthy and stay healthy for life.
Thanks for watching Hometown Health with Dr. Dan. To find out if chiropractic care makes sense for you, visit TuroFamilyChiropractic.com.